Hi, I'm Diane Ellis Marseglia, Bucks County Commissioner, and I'm here at Jefferson Health in Bucks County trying to find out from the experts what we can do to keep ourselves, our loved ones, and our neighbors safe as we navigate through the holidays and through the rest of the COVID pandemic. We will be talking to Dr. Gerald Wydro and some of his colleagues from the emergency department here at Jefferson Bucks, and they'll be able to tell us a little bit about what they're seeing, what their lives have been like, and what we can do to keep ourselves safe and to keep them safe.
Hello, my name is Dr. Gerald Wydro. I'm the Chairman of Emergency Medicine for Jefferson Health Northeast, as well as the EMS Medical Director for Bucks County. Today I'll be talking with Nancy Lodice, who's a registered nurse as well as an infection control specialist here for Jefferson Health Northeast, and Dr. Lauren Exley. She's the Medical Director for the Emergency Department for Jefferson Health Northeast Bucks Campus, as well as the Campus Chief. Today we'd like to talk about safety around COVID, what things that people can do to remain safe, especially during this holiday season. Nancy, there's been a lot of discussion around safety during the holidays and gatherings. Could you give your recommendations for, in general, how people can remain safe?
Sure. I think when we talk about safety, we have to remember first, the basics, hand hygiene. We have to make sure that we're washing our hands frequently. We have to make sure we're not touching our face, especially our eyes, our nose, and our mouth. And probably the most important task we can do, kind of life-saving, is wearing our mask. And we have to make sure when we're wearing our mask, we're covering our nose and our mouth.
Many times patients can be asymptomatic with COVID, not even know they have it or have very mild symptoms. Should those people not worry about some of these safety measures we're talking about, or should they also have concern?
Absolutely not. We all need to worry about it because an asymptomatic person can spread COVID just as much as a non-asymptomatic person. We need to keep in mind our vulnerable patients, our elderly, our immunocompromised. Personally, I'm dealing with that at home. Whenever I see my parents, I take care of them. They're 84. I wear my mask. They want to see my face. They want to see my smile. I don't let them see that. I keep my mask on. I wash my hands. And I actually put a sign on my parents' door. Nobody is allowed in this house without wearing a mask. I'm keeping my loved ones safe. I want you to keep your loved ones safe. And that's what we need to do.
I think one of the things that we've all been hearing about is that a lot of patients have been having to be hospitalized because of COVID-19. Can you give a little perspective from what you're seeing on the hospital side around patients coming in with COVID and the pressure that might be putting on some of the hospitals?
Yes, we are unfortunately reporting a large number of COVID patients. We are also seeing a lot of patients coming from families, and it is heartbreaking. Mothers who have it and granddaughters who have it, fathers and sons who have it.
So Dr. Exley, can you tell us some of the things that you do on the hospital side to keep yourself, your staff, and your patients safe?
Absolutely. So all of our staff wear masks and face shields. We glove for each patient. We frequently wash our hands just as we would normally do if we were not in a pandemic. We ask all of our patients and any potential visitors in the hospital to wear a mask as well, abide by hand washing, and to make sure that we're socially distanced at all times. We socially distance all of our patients in the waiting room as well as in the treatment spaces to keep everybody safe.
Dr. Exley, one of the things we hear about is that patients might be afraid to come to the hospital because they might catch COVID. Can you help us to better describe to the community at large the safety that is available in the hospitals and that they should not put off care?
Yes, absolutely. So I do hear that from patients quite often, that they were nervous to come into the hospital, and I do appreciate that people are trying to stay away from public gatherings and they're staying at home when it's necessary. However, if you have a medical emergency, it's of the utmost importance to come into the emergency department and have that evaluated and treated adequately. We should not be deferring care in the pandemic.
So Dr. Exley, there's been a lot in the media and the press about how busy the hospitals are. Sometimes hearing things even like at the breaking point. Can you tell us a little bit what you're experiencing, and can people come and get care if they have an emergency?
Absolutely. Our hospitals and our emergency departments in the region are incredibly busy. However, we are fully capable of caring for you. Should you have a medical emergency that you need to seek attention for, as I mentioned before, it is of the utmost importance that you obtain that care, and we are ready to take care of you.
So if I'm having symptoms of a stroke, a heart attack, if I've been severely injured, I should call 911 and not be afraid to come to the hospital.
Absolutely. And those particular illnesses that you mentioned as well are very time sensitive. It's important to get care early in your illness course, and it is very important not to delay at all.
Nancy, I've heard a lot about visitors. Can you give a little example of how we might have modified or hospitals are modifying their visitor policy around the situation with COVID?
Sure. We know visitors are integral to our patients', well-being. We had screening protocols in place when we were having our visitors, making sure they didn't travel certain places, making sure they weren't symptomatic, making sure that they weren't recently exposed to someone with COVID. So we had screening protocols in place. However, as the numbers started to go up and the patients started to, need more care, we had to limit our visitors. And there's certain conditions into life that we allow visitors for. And it's, discussed with the medical team.
And I think the key is that there's a plan around that. So we do allow visitors for pediatric patients and for end of life and people that may have certain, cognitive delay that might require support. But at the same time, general visitors really have to be restricted, really for the safety of everybody.
Correct. We're asking you to, again, try to do alternate communications. We have iPads for them to communicate. We are encouraging FaceTime with our phones. And our staff is really stepping up, and they are really becoming your second family members here in the hospital. And I couldn't be more proud of that.
So, Dr. Exley, there's been a lot of discussion around the COVID-19 vaccine. I know that Bucks recently received their vaccine distribution and is starting their plan. Can you give us a little sense about what the staff are saying about that? And more importantly, do you think that that's going to be a long-term strategy to defeating this infection?
Yeah, so overwhelmingly, I think that our staff are very excited that a vaccine is available and that it's available to them right now. I will tell you that I personally was vaccinated just several days ago, and I was very excited to be able to receive that. And I'm still here, and I only have 2 arms. So I think that our staff are excited about the vaccine, and they are very grateful that it's being offered to them. And overwhelmingly, our staff is accepting the vaccine. It is going to be a critical step in getting the pandemic under control.
So one of the things I get a lot of questions about is with the holidays coming and gatherings. I know that we hear a lot about staying within your bubble to keep safe. What are your recommendations as a healthcare expert for people to do around this holiday season and large gatherings, visiting, and the like?
My recommendation for my patients, my family, the people that I love in my life are to only gather indoors with the people of your immediate household. So those are people that you normally share 4 walls with on a daily basis, and no one else should be invited into that space. We all breathe in that space, and that is the primary method of transmission of COVID-19. So if we are breathing around other people, we have the opportunity to infect our loved ones, even if we're not feeling ill at the time. So I would say for this holiday season, we're going to have to look to other methods to celebrate, go to Zoom, go to other virtual platforms to enjoy your family's company and conversation. Hopefully next year and the year after, we will be able to celebrate in person. As long as we are able to vaccinate our public. It will be a very tough holiday season. This is a time of year where people love to engage with their loved ones. And it's sad that we're not able to do that this year. But in order to keep our loved ones, our family and friends safe, our neighbors and our community safe, it's of utmost importance that we don't gather indoors with other people.